Hello, everyone, and welcome to the COVID-19 Health and Medical Podcast Series. I'm Dr. Til Jolly, Chief Medical Officer of Aveshka, and I'm pleased to be working as Chair of the Medical Advisory Board for the Innovation Institute for Fan Experience, which is focused on the health and medical issues facing the global sports and entertainment industry, especially during this COVID-19 pandemic. Our weekly podcasts aim to bring you up-to-the-minute information about how COVID-19 is affecting all aspects of sports and entertainment from a wide range of health and medical experts. This podcast series will unpack the latest issues related to vaccinations, testing strategies, and other issues that sports and entertainment executives face daily. This podcast series will help you hopefully return to work, play, and spectate safely and effectively, a goal for all of us. Importantly, this podcast was recorded in the third week of March in 2021. I point this out because the COVID-19 situation is changing literally on an hourly basis, and we want to make sure you have the most up-to-date information. We will update this series on an as-needed basis. In this episode, we're going to discuss critical issues related to vaccines and vaccination with an internationally recognized expert on vaccines. We're going to try to bring you everything you need to know as we begin to gather back together in groups to make sure we do it safely and effectively. Our guest today is Dr. Bruce Gellin. Bruce is the President of Global Immunization at the Sabin Vaccine Institute and has had a distinguished career, which included a long tenure in the Department of Health and Human Services as the Director and the head of the National Vaccine Program Office. In that capacity, he developed the National Vaccine Plan, and he was among the leads for the very first pandemic influenza response plan in the Department of Health and Human Services. Welcome, Dr. Gellin.
Well, thanks for having me. Appreciate it.
We're going to ask a number of questions today, and I think our audience will be very interested. Vaccines are constantly in the news on a daily basis. First, can you kind of summarize for us a little bit about the vaccines we have in the U.S. Right now?
Sure. I mean, you're right. It is. I'm glad you put the date marker down because things do change pretty rapidly. So maybe we'll have an update on this one at some point. But currently, the United States has 3 vaccines that have been approved by the Food and Drug Administration. The approval is in a special category of it's called emergency use authorization, and that's to make vaccines or any product available that for which there's sufficient data that shows that it's safe and effective to be used broadly in the population. The asterisk there is they like to see longer use of these products, and so they really want to wait for 4, 5, 6 months to make sure that they've seen everything, because that's what they traditionally look at when they look at drugs and vaccines and diagnostics coming into the system. So the 3 that we have now are come to us in the United States under this emergency use authorization. Regulators in other countries in Europe and the World Health Organization have similar structures that allow these vaccines and other vaccines to be available. Right now, there are 3 vaccines, and what's striking is I've been doing vaccines for a long time, but never have you been anywhere where every conversation starts with Pfizer or Moderna, and now we've added to that a third one, J&J. So those are the companies that make the 3 vaccines. Pfizer and Moderna have a similar technology. It's called a mRNA or messenger RNA. The J&J product is using what's called a viral vector. So it's the approach that was used in developing the approved Ebola vaccine. So again, these are different technologies that get to the same endpoint. And that endpoint is to create in the body the target for the immune system to go after. So while they do it in different ways, the endpoint is to, again, create something that your own immune system can see and develop immunity to, so that when you're then exposed to the virus, you have protection against it.
So we hear a lot about vaccine hesitancy, and we probably don't even need to discuss some of the concerns, but there are concerns about this being experimental. And at one point they were experimental, but how do we approach an EUA versus full approval, and how do we explain the status of the vaccines now, experimental versus full use?
No, it's really an important question. I mean, if you talk to the people at the FDA, that's frankly how they see it, that the emergency use is not a full authorization and they're still looking at it. So I think that's part of the question, and that will be described by many people as experimental. That said, in the United States, 100 million doses have been used. So we've got a pretty good sense of how these are performing separate from their clinical trials. So I think the way to describe it, the way I describe it to people, is pretty much what I said before, that the clinical studies, what now everyone's heard about these phase 3 studies, which were 40, 50, 60,000 people in these studies to examine how the vaccines performed, how effective they were, and how safe they were. Those are as large as any vaccine studies. So the only difference is the duration of follow-up for how long we've seen the effect of these vaccines when used in the larger population. That's really essentially the only difference. I think it may be unfortunate that this label of experimental, because the difference between the amount of information we have about these vaccines versus other vaccines is pretty limited as far as that difference, because we have so much experience with them now.
Yeah, that's just so important to talk about. And we're going to address some of the issues related to getting crowds back together, which we're starting to see on sort of a disorganized basis, but we're going to need to start to see across the sports industry, entertainment industry, and across other industries on a more organized basis. But let's also talk about the variants. There are mutations of the virus, and there are variants of the virus that we hear about. We hear about one that started in the UK and others from other countries. It's a little unfortunate that we name them by countries, because that's not really the issue. But let's talk a little bit about the variants, and then how can we assure ourselves that vaccines are going to be effective against those variants?
Sure. I know that you're not interested in the lecture on molecular biology, so I'll skip that. Other than to say that viruses mutate, that's not surprising. Some mutate faster than others. For example, we're very familiar with that issue with HIV. We're even more familiar with that issue from influenza, which is why we have to look at the influenza viruses that are circulating and tailor the vaccine each year, which is why part of the reason why there's an annual influenza vaccine, to make sure that the one that's given this year is tailored to the viruses that we might be exposed to. It's interesting, and I think it's an important conversation, because 6 months ago, while the virologist told us this virus mutates a lot less than others, we're watching it. It seems fairly stable. Well, guess what? Now variance is in the news, because we're seeing that they are mutating and creating some differences. So with that example of influenza, why that matters is when the viruses do have some of these changes, they might have a different behavior. So they might be more contagious. If you were infected, you might get sicker. And then there's this question of whether or not those changes now evade or partially evade the immune system and the immunity you might have from either a prior infection or vaccines. So that's what we're watching. And I think the biggest concern, or all those three characteristics are of concern. From a vaccination standpoint, what's going to be critical is to be able to protect against variants that might still be protected by the vaccine immunity that we get. And that seems to be the case, particularly with this British variant. But we're going to have to continue to watch these. Again, this is mid-March, and only to say that we're going to continue to watch to see this. It's not going to be a surprise that these pop up in other places. The more people are looking for these, the better testing we have on this, what's called genomic sequencing, to look at the genetics of these viruses. We're going to see more of these, and we're going to have to make a distinction between those that are different and those that matter. And that's the important consideration now that we're hearing about.
That's important information, and that's really going to affect, as we discuss, sort of what normal is and how we get back to gathering the way we used to. But let's talk a little bit about another key issue, which is herd immunity. It's got all kinds of implications around it, but it's important for our audience to understand what herd immunity is and what it isn't, and how we know we've reached it, even if we do.
No, that's a great question. I mean, and it's, so I mentioned before, now everybody has Pfizer and Moderna in their lexicon. Herd immunity is something that you and I talked about because we studied it in medical school, but now it's part of everybody's conversation. The basic concept is the more people who are immune, the fewer places the virus has to go. I mean, almost think about it in terms of firefighting, that if the forest floor is damp, a spark isn't going to go very far. And that's sort of the concept. And the herd immunity piece, then it's a math and epidemiologic concept. We're not going to know on a given Thursday in May that poof, we've hit it, because doesn't work that way. But the general concept is the more people who are immune, the fewer places the virus has to go. And so in effect, that actually protects the community more broadly, even beyond those who've been vaccinated. The reason why it's so tricky is that what I mentioned with the variants, that will matter depending on how infectious the viruses are. So this one that we're focusing on now, the one that's been increasing, and the CDC thinks will overtake and be the common virus in the United States by the end of the month, the UK one, or called B117, that's more infectious. Therefore, think about that spark analogy. There have to be many more people who are immune to prevent that one from finding somebody and infecting them. So given the infectiousness of this virus, a lot of people in the community have to be immune to be able to get that population effect.
And I like the forest floor analogy. That's very important for people to understand. And I think we also need to understand that a community is not the United States as a whole. The community is really regions and cities, and we're seeing differences among various regions in uptake. And so, I'd love you to comment on how important it is to really have some commonality of our messaging, but also make sure that we get our vaccination campaigns appropriately targeted at each community, because every community is going to have different needs.
No, there are two things going on. There's what's happening in the community as far as the infectiousness, and what viruses are in the community, and then separate of how well any given community is protected and what kind of immunity they have. So you started to see this concept of hotspots where there seems to be outbreaks of some of these variants that are taking off. I think we're going to see those. It's almost like popcorn popping. You can't predict where it may happen, but I think it's going to be important that the health departments, both at the local, the state, and national level, are taking a look at those. So that's going to be important to know what's going on in a community, because that's going to affect some of the behaviors that you can have, whether or not you can get to go back to doing some of the things that are more normal. And the flip side of that is looking at the level of immunity in the population, which is a combination of, at least at this point, of people who might have some immunity because they've been infected in the past and have a natural immunity from that, plus the vaccine-derived immunity. So those are the two things that we're looking at. And when you look at the CDC guidance on what you should do or what you're able to do, I think it's going to be very much contingent on that, of what's going on in the background, how much infection there is in the background, and how immune the population might be.
So that's great. Let's talk about a few specifics. So we hear questions all the time about should I get immunized? Should I not get immunized? Should I wait? And so I'll just propose a few questions and see your thoughts. First, if you've previously had documented COVID-19 infection, should you get immunized or should you wait?
So, I mean, this is another one. Well, again, this is mid-March 2021. So we'll put a time marker down there. Right now, the recommendations are yes, you should. And the reason you should is that your prior infection, while there's evidence that it does provide you some protection, we don't really know how good that is and how long it lasts and how variable it might be. If you've had a mild infection, if you've been asymptomatic, or if you had a severe infection, you might have differences in that immunity and how long that will protect you. So that's why there is that unknown part of that infection and how well natural immunity will protect you. I will say that people are actually obviously taking a hard look at this. There have been relatively few people who've been reinfected. Again, the variants are the asterisk there. But for the most part, people who have had a documented COVID infection before have not been reinfected. There's some isolated case of that, but given the amount of virus, it's really pretty, that number is pretty low. So that tells you that in general, you're getting some immunity from that infection. But then the thought was, well, let's make sure that you have a durable immunity. And that's why, particularly when you look at these 2-dose vaccines, the booster shots, and I'm sure many people are familiar with vaccines in their kids and the importance of boosters in boosting that immunity. The boosters, the vaccines then provide that boost to ensure that the immunity you have is what you need and is both strong and will last for a while. That still is an ongoing discussion as far as whether those people need the 2 doses or not. Right now, that's the recommendation, is to go ahead with this 2 doses, even if you've had vaccine before. Some might see that the prior infection might almost be the equivalent of that first dose. But the short answer, which you didn't get until just now, is yes, you should, to make sure that you do have immunity going forward.
Right. It's a very important message. So a couple of other questions that we are approached with all the time. What about the side effects? We've heard about some people having some potentially concerning side effects, particularly after the second dose of either the Pfizer or the Moderna. How would you address those? And how would you address concerns about getting those side effects and people who say, I don't want those side effects, I'd just as soon not get vaccinated?
Well, that's really a critical question. I think particularly because this virus is new, the vaccines are new. They were made at really quite an amazing speed, in part because of investments in science for decades before that. So I think all those raise questions about safety and side effects. At least what we saw first in the clinical trials in those tens of thousands of people was a clear sense of what those side effects would be. Primarily local, the things that you're familiar with before, of a sore arm, maybe fever, maybe aches and pains for a short period of time, and that goes away. But the second dose in the 2-dose series has had more an accentuation of those, where people might feel really achy, almost feeling like they have the flu for 6, 8, 12 hours within a couple of days after being vaccinated. Those have been, no one's been hospitalized because of those. A lot of people have been miserable because of those. But I think that what that shows, when you look at the science, that really is an indication of how well the immune system is working in developing that immunity. So I think it's really important for people to know that, because because of the way that clinical studies were done, at least as we're looking at the science right now, that second dose is really important, and you shouldn't stay away from it because you think, well, I may have enough immunity to last. I don't have to worry about that. Those side effects are transient. You may not feel good for several hours or half a day, but once you're past that, you then have the immunity that you need.
Thanks for that. And one other specific vaccine question, and then we're going to talk a bit about vaccine campaigns and particularly how the sports and entertainment industry broadly can assist and is assisting. But from the early numbers, we heard about remarkable efficacy of the Pfizer and Moderna vaccines. And then when the Johnson & Johnson vaccine came out, the numbers weren't quite the same. And we have people who say, I want to wait for the, quote, good vaccine. There are obviously methodologic change differences in the way they were assessed. What do you say to people who say, I want to wait for a specific vaccine?
Well, again, here it is March. We're going to see more of this, as there are other vaccines that are in the pipeline that'll work their way to the FDA. And based on what we've seen so far, we expect them to get similar approval. So there'll be other vaccines. And so increasingly, you're going to see a number of different products that have different characteristics. I think let me take a step back. When the FDA set the guidelines on what they were expecting how they expected the vaccines perform, they didn't know. They'd seen some of the early science of some of the immunity, but they said, we're going to look at these vaccines if they're at least 50% protective, 50% effective. And then they come in at 90, 95, which is beyond anybody's expectations. And frankly, they're better than most vaccines. All of them are better than most vaccines. Maybe the one exception is measles, which is the measles vaccine, which is unusually good in the sense of it's probably 97%, 99% effective with 2 doses. But these all perform incredibly, and importantly, they are keeping people out of serious harm. So I think the important thing for now, because the demand is so much more than the supply, is shopping around and particularly taking a pass on one that you have available could be a problem, because the longer you wait, the more chances you have of being exposed and getting the infection and the consequences itself. So I think the recommendation by everybody is these vaccines are all incredibly good, incredibly safe, and as people are scrambling to try to make appointments, take the one that you can get.
Right. Very important. So let's talk a little bit about vaccination and vaccination campaigns, because as we've said and our colleagues have said, vaccines aren't particularly useful at all until they get in arms, and vaccination is really the important issue. Many of our colleagues in particularly stadium management are now opening up their venues, either their parking lots or their actual venue, for large-scale campaigns. How do these vaccination campaigns work? And I will praise these venues for cooperating with public health. This is not normally what they do, but a little bit about the public health infrastructure and kind of how this works from a operational and campaign standpoint.
Well, you know more of the operational stands, but I think I do want to thank your viewers here. This has been tremendous, because this is something that in the United States we're not used to, these large scale campaigns. We knew about them in polio decades ago, but really that's not the way we have operated. Primarily, it's been through the sort of more traditional public health infrastructure, but recognizing the need for speed. Having these large venues and then figuring out the flow and the sort of the operations research that maximizes flow has been critical. And I guess my take on this is that while early on the road was a little bit bumpy of how these go, there's been a lot of sharing, and I guess that's going on within your clients as well, as how to best manage these things in the most efficient way. It's adding a huge amount to the nation's vaccine uptake. I will say that in public health circles, there's this conversation between speed and equity. And I would just say that because often speed favors those who can get there, those who know how to manage the internet and make an appointment, those who have cars and go to a drive-through. So I think that's something, as you're thinking about this in these various venues, to work with local public health and see how can you tackle both of those at the same time, where you're able to not only do these things on a large scale, but you're also reaching into your communities and ensuring that those in the communities who might not be getting into the drive-through lane have access.
Thanks for that. Now there are many concerns about populations that have what we consider poor uptake of the vaccine for various reasons, whether it's the African American population, which has a long-standing difficult history with public health research in the past, not just the Tuskegee experiments, but other things. Populations that perhaps don't trust any establishment, or other populations that are inhibited by either language or economics, or, as you noted, even things like poor transportation or poor internet access. We're starting to see some more public messaging from many corners to try to advocate for improved vaccination. But I think the sports entertainment industry has a unique reach into the American population, and perhaps speak a little bit about strategies to increase vaccination rates and what that's going to do for us.
Well, that has about 20 elements to that one. So
Right.
I'll take on 19 of them, but it's really, I think you're right. Given the draw of sports across America, and given the sort of the unique niche, I think it's really an important one. I guess I'll start similar to what you talked about before, is this public-private partnership with stadiums and public health, just to get these things organized. I think I'll put the time marker down of here we are in mid-March, where right now the demand is much more than the supply. And I think that as supply increases, we're going to start to see more of what you talked about, more of those who have been, for a variety of reasons, not getting vaccine. And I think it's going to be important to sort out the difference between those who have trouble with access versus those who have some concerns about the vaccine themselves, and trying to make sure we have those, get the right diagnosis and try to come up with that right solution. I think a critical piece of this is understanding your communities and community voices. We can have people like the Surgeon General or the President talk to people, but I think that what's going to matter most is people want to hear from people like them. are people who they trust, whether it's their local doctor, maybe public health, maybe somebody from their local hospital. But I think local matters a lot. And again, I think what a lot of people are waiting to see, because I think a majority of these people are taking a wait and see attitude, is how is this playing out in people like me? Have they had a good experience with the vaccination? Have they has the vaccine, and have they had any side effects to worry about? So I think that's an important part of it. So the community matters a lot, and trying to think through in each of your communities, who are the influencers? Who are those voices that people go to for a variety of issues, whether they are health, they might be religion, they might be community organizations. I think those are the people who are going to have the most impact. And if you're thinking about partnering, look for those kind of organizations to try to help reach the people that might not come to you.
Bruce, there's an important issue related to our public guidance about spacing, and we've heard about 6 feet as a safe distance among people. But in your typical sports arena or stadium or concert venue, even at lower capacity, once people start to move around, it's tough to maintain that distance. And then we hear different standards in schools among children who either are sitting still or need to move around. How do we address that to really get us back to some level of occupancy?
So children sitting still, I'm not familiar with that. But on your point, though, I think that's really a critical question that again, it's been raised by schools who frankly can't manage, because there's not enough room in a school to be able to have all the kids there that they're supposed to have there. And that will then lead to hybrid models and virtual models and the like. So the schools have been front and center about this question. The 6 feet is, frankly, the science behind 6 feet is interesting, but it's got more legend than science to it. It served us well, but the 6 feet was not determined in an era of changes in air conditioning systems, wearing masks and the like. So I think we're going to see this being addressed. Probably we'll see it first with schools, but it'll apply to other places of trying to think of what is the distance when these other things are in place, both in terms of mask wearing, air handling, indoors versus outdoor, and vaccination status. So I can't predict anything other than I know that CDC is going to have to be addressing this because it's relevant to so many parts of society. Whether we see that shrink in the near term, I don't know. But I think as with vaccination and the ability to have your vaccine change your behaviors, I think it'll also be contingent on what's going on in the background. If there's a lot of virus in the background, people are going to be quite nervous about crowds because of exchanging air. As the virus rates in the community go down, I think that's going to allow some more opening up in terms of what people can do and have some bearing on the distance between people. So again, I'm not sure we're going to see specific rules about 6 feet versus 4 versus 3 versus 2. There was a recent study that looked at, frankly, comparing 2 schools of the 6 feet versus 3 feet when all these other things in place and didn't see a difference. I think we're going to see more of those that are going to help to inform the guidance that CDC puts out.
Very important. So a couple of sort of specific post-vaccination questions before we close out. And this has really been an outstanding conversation. So if you're vaccinated, as many people are now, what can you do and how can your behavior change?
No, this is the question. I think it's frustrated a lot of people not to get clear guidance on this. I think that the reason, I'm going to defend the CDC for a minute, the reason that it's not been such a light switch, now that you're vaccinated, the world is different, is because we're still seeing how this is playing out. Right now, while there have been lots of people vaccinated, there's still most who are not. And so I think we need to remind ourselves that just because you're vaccinated, there's still virus out there. And while the vaccines are primarily designed to protect you, you also want to make sure that you're not going to be causing harm to others if you happen to be infected and passing that along. So again, I think we're going to see that the guidance changing as the situation changes, as more people are vaccinated, as there's more immunity, and as there's less infection. I say that because the variants are in play here too. As the infection rates go down, then I think there's going to be much more lenience, as far as being able to do more things. Right now, the guidance is very conservative. It says if you're vaccinated, you can go and have dinner with another family who's unvaccinated, but it's really trying to minimize the risks of a problem, in the sense that the same things are in play, that the risk is breathing somebody else's air if that air has virus in it, and that's the bottom line. So trying to minimize that. So I think that's what's been confusing to people. We're going to see that opening up gradually as we have more and more confidence that the vaccines are protecting others as well as protecting you.
So I'll ask for a little bit of speculation, but you know, we can't predict exactly what's going to happen. But we've had a year now, or over a year at this point, of not being together, and whether being together means being in restaurants with groups of people, or being in stadiums, or in concert venues, or in local festivals, or any of a number of places. And everybody kind of wants to be back together, and areas of the country seem to be doing it differently. But what do you see the summer and the fall looking like? And we can't forget schools. That's another issue also. But what do you see the summer and the fall looking like, realizing that it depends on a lot of factors?
No, there are a lot. I think that part of this, and again, you have to, I think, make a distinction between outdoor and indoor. And obviously you have a number of different types of venues. And again, it's about breathing somebody else's air that has virus in it, and the degree to which there's some protection against that. So I think as we see, so the one, again, I hate to do this, but the caveat is the variance. We've seen over the past several weeks and months, the downslope of infections, the downslope in hospitalizations, the downslope in deaths. But here we are now, mid-March, and you're starting to see that level off. And I think that's a combination of things, but part of that is the increase of these variants that have now come through. And they're coming at a time when some of these, and you've heard this from Dr. Fauci and Dr. Walensky, and the concerns that if we're opening up at a time when these viruses are still out there and they're more infectious, we might find ourselves with another resurgence. So I think that what's going to matter most is the amount of virus, the amount of infection in the community. As that goes down, that's going to be probably the biggest indicator of the ability to then do some of the things that you've mentioned. So right now it's very conservative as far as the number of the density of these places, whether it's in a restaurant or a stadium. But I think that we're going to see that as those rates go down in the community, that'll allow more potential for people to get back gradually to the things that they're hoping for.
Thanks for that. You've really given us a lot of information. Do you have any closing thoughts, any major issue that you'd like to leave us with?
No, thanks for doing this. I do think that that given the importance of sports in America and elsewhere, I know you have an international audience, that this is something that people are really want to get back to, the sports venues and the concert arenas and the like. I mean, it is March Madness, by the way, so we're going to be watching that from a distance on our televisions. And I guess this is the one time where people say, well, I didn't really make it to the Final Four this year, because very few are. I think the other piece, and I don't know where this is going to go, and maybe this is a part of the follow-up, is how this is going to play out over time in terms of how people are documenting their immunity. Whether or not, I mean, and that's not such a simple thing. You can show your vaccine card, but that may not mean a year from now that it's still valid, because we still are learning about the duration of protection. I don't think people are going to be taking blood tests before they go anywhere to see what their level of antibody is. But I think this is going to be something that we're going to all have to pay attention to, because from the government standpoint, and I think from the private sector standpoint, they want to be able to provide safe environments for everyone. And we've started to see this in other countries, how there have been these, in Israel, they have something called a green pass that allows people more mobility. I think we're going to see more of this. I don't quite know how it's going to play out in terms of the legal and ethical pieces of this, because there, you can see already how there's going to be different classes of people who have different status. So I think that particularly from a standpoint of a venue, I'm not sure. Maybe you can tell me how it's going to go. Is this going to be the equivalent of a boarding pass or your QR code to get into a game? But I think that that's something that we're all going to have to watch. There's a lot of technology out there that is going to allow for that, but then it gets into these other larger societal issues. So separate from the science of vaccines and virology or the logistics of vaccination is how this fits into the sort of our social getting back to some new normal.
Very important points, and with that, we need to close. But I really want to thank you, Dr. Bruce Gellin, for your important insights and really a fascinating discussion, and for your continued contributions to the public's health.
Till, thanks for the conversation.
Thank you. And on behalf of Aveshka and the Innovation Institute for Fan Experience, I'd like to also thank you for watching this important podcast, and for continuing to engage with us as we continue the COVID health and medical playbook series. In our upcoming podcast, we're going to discuss important issues related to performance sports, testing, and other things that all of you and frankly, all of us need to know as we enter the next phases of our COVID-19 response. For more information on Aveshka and IIFX, you can visit us at www.aveshka.com, or importantly at www.iifx.org. You can also follow us on Twitter and LinkedIn. Until next time, please stay safe.